You put it up here, put it here, so you're not, you know.
Right, right.
Yeah.
So you should make a video of that.
Yeah, Devin came to me.
The shit you're saying over and over in your clinic, is there stuff you're saying over and over to your patients?
Yeah.
That's the stuff that, what? Give me an example then.
So I do a lot of stretches, but then they're like, okay, well, after stretching, how do we strengthen? So there's a real call for some type of rehab core strengthening stuff too.
Yes.
So
yeah, you know, listen, now here's...
I always, I tell people about foam rollers, I tell people about, I have an elastic band that I have from years ago that I just kind of like, okay, you could do this, you could do this, you could,
Okay, if you tell someone, you're only gonna get a certain amount of compliance.
Right.
So you gotta show them.
Yeah, so I'll stop and I'll show them.
Send them a video.
Yeah.
Because
I think the videos are the best because some people after, and I've gone to, we've done handoffs where I said, okay, we're gonna send you icing, and what is this? And they're like, okay. And then when Devin says, we'll send you a video. And then the patient is almost like,
you can see their body language.
I have a question. Are those videos that are on there, are they the same ones that you have, that you sent out, or are those different videos?
Aaron's got all the videos. Right now, I think there's too many videos. We got Barris doing a lot on there. I'm gonna take Barris stuff off.
I mean, that's what you sent out, right? But I'm talking about what we send a patient.
they're all the ones that you do.
I did
I
a lot.
haven't seen any of that.
Did you see any videos?
No, I've seen the ones that you sent to me, but the ones that we sent to the patient, I don't know what we're sending.
They're all the same.
You need to look at that then. You need to look at every single one of those videos.
No, I looked at all the videos that we have, but I'm saying the ones that we send the patient, are they the same ones?
You tell me. You need to look at.
Oh.
Here's what I'm trying to say. Tell your front desk to send you the videos. Look at the videos that the front desk is sending. I would imagine they're the same ones.
Yes.
They should be.
But here.
Because I wanted her to do that, and then she couldn't send them to me, because I wasn't a patient, I think. Do I have to become a patient so she could email them to me, or
No,
she
she
can
do it to
use your
your personal
email
email address.
just email them to me?
Yeah.
That's something. Dig into that.
Yeah,
That's huge.
right.
Okay, so there's a little operational, little glitch in there that you guys should be better. You know what I'm saying? So get that glitch. You want to know exactly what's on the video that you're sending out
Right.
to the patient.
Well, the other day, this is a good example too, because, I've been going through and doing a lot of the back stretches. And one of the stretches that I was missing is when you lay the person completely on their side and do this.
Right.
And so Devin and I went over that because she had a question. I'm like, okay, which back do I send them? Because there's like 2 or 3 back stretches. And there's, you're in different clinics. They're the same stretches, but you're in 3 different clinics.
Right.
Doing them.
And that's what I mean. I'm going to clean those up. There's a lot of junk in there.
So, yeah. So I'll do these. But then
You know why I like that one, by the way? Okay. First of all, I like the
It's the most
glute.
effective.
Listen,
glute piriformis area.
it's huge. You get that, but you also get that one on this one. I think actually a little bit better. You get the quadratus lumborum on that one.
When you lay completely on your side?
Yeah, and
Yeah.
you push that down.
Yeah.
And I don't have a good, and I think that's one of the better stretches for the quadratus lumborum. And if I ever find a spasm, it's in the quadratus lumborum.
Right, hip hike and all that.
Yeah, and that's when I go into the McKinsey stuff.
Yeah.
You know what I'm trying to say? So, these are good questions though. So you've got to clean that up, okay? Because that's a flaw, okay?
Is that?
It's not, it's a flaw. You want to know, as a businessman, you want to know every one of those videos that goes out in your clinic. And if you're, listen, strengthening, let's talk about strengthening. So there's yoga ball,
There's yoga ball, there's
gym.
There's gym, there's bands.
Well, no, that we have a video of.
Oh, okay. Oh, that you have a video of.
Yeah, so I want you to look at the yoga ball video.
Right.
Look at the yoga ball video. If you don't like it or you don't like one, I want to know. Because you don't, listen, I don't force feed you. You have to do something. I don't force feed you. Those videos are quick too. More than likely you could look at all those videos easily in a day at work. You know what I'm saying? So look at them when you're not doing anything, look at the video. So we've got yoga balls for strengthening most of the lower back. Look at that stuff. Okay, because then if you like it, we should be able to have somebody kind of train it a little bit. Get a yoga ball in. We've got posters for rolling. If you like the rolling, you're gonna put a video on it, you can get a roller. We'll get a roller for the clinic. So we can get a ball, we can get a roller, we already got 2 of the posters. Okay? Myofascial release. I do like the rolling. I think a lot of the doctors like the rolling. I just have never used it in my clinic because I'm.
Yeah, I don't use I mean, I'll use, when most people talk about IT band
Yeah.
rollers, that's the only thing that I really, the
I-
only
I-
other thing that I use it for was if someone has really bad kyphosis, I have them lay on it.
Yes. I used to have a, yes,
I have
I,
them
yes,
like
yeah,
this
listen,
with
hold
their
up.
head extended.
Yes. Okay, so we've done that video too. And that's a stretch.
It's a great,
Yes.
open up your
Yes.
thoracic
Can you put a
spine.
video on that together?
I could do a lot of things, I just need I need the time and, you know.
No, you got time in that clinic, don't you?
I
have time?
know, well, that's just it, I need to make sure we have a good camera,
I might even have a video of that.
yeah.
No, listen, here's what I want you to do. Don't worry about making this an Academy Award.
Right,
Don't worry about a good video. Do your phones. That's
Right.
all what we need. And then once we, hey, this is a pretty good one, we can clean the video up later.
yeah,
Okay, because I have so many doctors wait months
right.
because they want to get the perfect
I
shot.
use that vertically, is that what you're talking about?
Yeah, you use it vertically.
All right.
Yeah, because someone has, very bad kyphosis, or
I use it horizontally.
you try to adjust
I
them.
use them vertically.
I use them vertically.
So you use it this way?
Yeah.
Oh,
So
I
if
do
you
the
have- If
opposite.
you have someone that's really like this,
Right, 'cause it
head
does
forward
open
and
out.
thoracics, and you try to adjust them and they're like concrete, do this to actually just slowly.
Yes, no, I do that one.
creep to
But I
sit.
do it this way because you're pivoting over that.
Yeah, I've done that too, and that hurts.
It does.
It does. It hurts.
It's
So what I'll do is I'll put this, and I'll tell people if they have a flat lumbar support, I'll put, it's like, okay, lay over this to try to restore some of the curve, the lordosis in the lower back.
and I'm okay with that. Listen, let me tell you a story about this. Okay, I'll tell you how sore it can get. Remember the old roller tables?
Oh yeah, I got it.
Yeah, so this is 1985, man. I got on that roller table for my thoracic.
Yeah.
20 minutes, pretty tough guy. Nothing. That day I got, that night, a tremendous amount of pain. Okay, when I can't sleep in pain, and I'm up moving around and dying, and I'm in the shower, and I'm thinking, what the hell? And then I realized what I had done. Okay?
Yeah.
So I stayed away from it, and I did it again about a month later. I'm a tough ass, I probably loose now. Okay. Same freaking thing.
Yeah.
Okay, so you're right. So, but here's how I explain to my patients. Have a seat right here, and this is what I do. I like that one. We should get that back on. So, and they all know when they have this, don't they?
Yeah.
We're going to try to loosen this up, and I'm going to stretch it. Face this way, and I'll have a decent sized roll.
So I actually take a headpiece roll.
Yeah,
of
that's
paper,
good.
And I said, okay, this is where it goes. Lay on it.
Yeah.
This is how it feels. Okay.
So I'm just going to use my arm. So you're going to put this roll anywhere kind of through here, all the way back. Yeah, keep going. Boom. And then throw those arms back. This is why I go over vertical to get the apex right on that thoracic. Now, I'm going to start you off 30 seconds a day. Okay? You do the first day, you don't get sore, increase it another 30 seconds. Come on up. You increase it 30 seconds. If you're not getting pain, up to 3 minutes. Then I'll have them do once a day, 3-minute lay in there.
Right.
Okay, also there's some angels
Yeah.
on the
So
wall.
you do it
And-
horizontally or vertically?
What do you mean?
The formula
Horizontally?
horizontally.
Because I don't think you're changing much of the curves if you go all the way up and down. I think I'm really putting an apex right there.
I see what.
You see what I'm saying?
Yeah, I
To
see
bend
what you're
right
saying.
over that piece.
Right.
When I have a degenerative hip, they're usually in a hip flexion because they lose extension first,
Right.
right? I'll lay them
Face
face down, yeah, and I'll put a roll underneath the hip to strengthen, you know what I'm saying? So if this hip is degenerated, it doesn't go in extension, I'm gonna put something, a book, right there to keep it in extension.
Mm-hmm.
You know what I'm saying? And I'll give them that stretch. Okay? So I like it, make a video of it. That's an easy video, Dean. Put the instructions in on the video.
Yeah.
30. I say
And most people, when they come back and they've been doing it, feel different. They're standing up straighter.
yeah. I like that one, I got away from that one, I like it.
Yeah.
I get a video on it. 95% of the doctors I tell to get a video, they never give me a video. Pisses me off. Get a video. You're a little bit more weird. You might follow through.
Thanks.
Listen, ton of home therapies, ton. All on videos. You have to know them exactly. The staff has to know them exactly. That's the way the clinic's going to thrive better. If you're sending out stuff that you're not sure what's on it, and then what happens when the patient comes, man, I don't know about those stretches, doc, and you're thinking, what the fuck is he talking about? Did you ever get in one of those and you're thinking,
When they come back, I ask them to show me what you're doing.
exactly.
So I know what they're doing.
That's what I do too. If I don't know what the hell they're talking about, well, show me.
Get back, because then you can see if they're doing it.
But you cut the chase, get to all the videos. So that's yours. You're gonna get me a video on that thoracic thing. Okay? Bone roll. So remember the strengthening. And by the way, in the gym, because this is a fairly common posture,
Yeah.
I got stuff to strengthen.
Yeah.
Okay? So there's stuff I'm doing at the gym for that condition.
Oh, that tells people that.
Right, okay? What you might want to do is just even give them that video of just that move to know that that's where we're going to go on in the future. What I want them to understand is this is their progression of therapies that we're doing to go, first
Right.
it's mobilization, then it's strengthening.
That's what I try to, that's why I like that paper, because it actually shows the phases that person
Hey,
has.
can I take a look at it?
Yeah. Hey, listen, first phase, so you don't like anything, rip it apart, we'll put it in, and right away, I'm going to make the wording way bigger.
Yeah, I like
It's
that,
too slow.
because that's, and I try to tell the patients, okay, first phase of care is the most intense, blah, blah, blah. We're
Perfect.
gonna see a lot in the beginning, and then as you get better, but we want to stabilize and strengthen.
Yep. Perfect.
So.
Questions, comments before we get on to your guys' stuff? Nope. You asked way too many questions anyway. Okay. All right, you ready? Who wants to go first?